Dr. Barrett, you began your medical career practicing internal medicine. What prompted you to make the switch into aesthetics? What was that journey?
It was really a combination of things, I would say, but when I was practicing, I did what is now considered VIP medicine. So I used to see a new patient for an hour, a return visit for 30 minutes, and then I started to see things changing. I also I practiced initially in Chicago, and then I went to Florida. So I saw these older patients who were super active, and they would always just say to me, "Oh, I look in the mirror and that's not me. I don't know, why I look that way. I feel so good." And then I decided to start getting into skincare with Obagi products, and it was really a neat transformation. And then Botox came out, and that was really fun to do. So I started to be able to make these patients kind of feel the way or look the way they felt, and it was really exciting. And it was hard to do both because I had quite a few very ill patients, and it was difficult. And I also had young children, so that kind of came into the mix. So I transitioned into aesthetic medicine when aesthetic medicine really wasn't that much. I mean, really it was Botox and these very light fillers and skincare. And it's been really fun because that was 22 years ago, and I've kind of grown with the whole field of aesthetic medicine. So that's it in a nutshell.
That's an interesting journey. Moving forward, what are some of the procedures or trends or products that are most exciting to you?
Well, I think looking back at where aesthetic medicine came from, when I started, we were treating lines and wrinkles. Then we were treating folds. Then we were starting to treat areas on the face. But I think probably the most exciting thing was when I started using Radius to actually treat the causes of aging instead of the symptoms. So the symptoms were here, and that was what we were initially treating. And then we started to say, well, wait, if we do what everybody's doing in the mirror and we put volume up here and anchor, this is going to treat the symptoms. And it's amazing to me that there are aesthetic injectors, I hate to say, out there that still don't really appreciate this, but it's really life-changing for patients. So going forward, we're doing that with other products. Now we're doing that with threads, the thread lifts to kind of treat those symptoms, treat the cause instead of the symptoms. So that's exciting. Probably most recently, exosomes has been really neat, regenerative medicine. So regenerative medicine came out with orthopedics and I think dentistry first with like plasma and then stem cells. But now we have exosomes, which are a little more reliable, I would say, than PRP, which really is dependent on your body and how your PRP is and how healthy it is. The exosomes are actually coming from another source, like a very young, youthful source. And it's really the growth factors and all the healing factors and the collagen producing products that are going to be put into your skin or into your scalp and just helping your body restore itself. So I think that's fascinating.
Very exciting, very fascinating.
I also think I read recently that is age going to end up being like a chronic disease? Is aging going to be a treatable chronic disease? So it's really regenerative medicine, I think, is really jumping into the aesthetic world, and it's going to make a very nice difference.
Very exciting things on the horizon. Oftentimes patients come into your practice and they might seem perhaps a little intimidated because they've never pursued any sort of aesthetic treatment. What should this sort of patient expect when visiting your office for the first time?
Well, I always congratulate them. I let them know I think they did picked a good practice to start. I think with Renew, we're actually very, it's a nice practice to come, especially if you've never done anything, because education is really a high priority. We want our patients to understand what's happening with their face, why this is bothering them, what can we do, what are the options, is it skincare, is it injectables, machines, and the nice thing about Renew is that we have the whole wide variety. I always say we have something for everybody, and we're gonna listen to them. We're gonna listen to what are their expectations, what are their fears, what are their questions, what do they really want to achieve. And I think it's a big difference as opposed to other practices. And I think we're very honest with them too. So we always let them know, if I feel like there's something they need that I don't do, I'm gonna send them somewhere else. But they're also going to get very holistic care, and they're going to be usually very happy with why they came, and they're gonna be very well educated and make those decisions together.
Wonderful. Some patients visit your practice and perhaps they're new to aesthetics, and also they know that there are some options that they would like to explore for perhaps inducting collagen or lifting, tightening, etc., but they're not interested in any injectables. What options are available to them at Renew?
Oh my gosh, we have many. So, like I said, we have a whole gamut. So we have the injectables, a lot of times that's more instant gratification, neuromodulators, fillers, but we have a whole array of machines. And we have machines that will lift you, like all therapy, non-invasive lifting. We have machines that will tighten, so something like our Renew Cool Laser, which is gonna tighten, it's gonna treat pigment and pores. We're getting a new one that's gonna be specifically for tightening the eyelids, can get right up to the lashes, and it's a single treatment that's gonna probably, have some people not having to go get surgery. We have machines that can be painless without downtime and can give some nice tightening, like our radio frequency. So we have a lot of options, microneedling. So, that's one thing we always try to figure out, like when a patient comes in, are you okay with needles? Are you okay with injectables? If you are, great, we have these options. And if you're not, we have these other options. In reality, actually, it's better to have a combination, because combination therapy is really where it is in every field of medicine, I feel like these days, but especially in aesthetics. So, it's not like, okay, there's a nail, here we have a hammer. You really want all the tools, and I think that's one thing we excel at Renew as well. And we make sure our tools are good.
Right, they're very important.
Yes, they're not just the name ones that are popular. They really work well, they do what they say they're gonna do, and they make sense.
Wonderful. Dr. Barrett, thank you very much for taking the time to share a little bit in regard to your background and some of the treatments and procedures that are available at Renew.
Thanks, Ashley.